Hi, everybody. Thank you all for being here. My name is Linton Freund. I'm a fifth-year PhD student in the Genetics, Genomics, and Bioinformatics department. I'm also a graduate student in Dr. Emma Aronson's Environmental Microbiology lab, where I look at all the microbial ecology within the Salton Sea, specifically the seawater microbial community and the microbiome in the dust. So I have the pleasure of moderating this panel today, and so I'd like to give you first just a brief background on the session and then introduce our panelists. So this session will delve into the detrimental health effects of environmental pollution at the intersection of climate change in local and marginalized communities at the Salton Sea, California's biggest lake, specifically focusing on dust from the exposed playa and aerosolized lake spray. Discussions will encompass water quality changes stemming from agricultural runoff and harmful algal blooms. Despite a lack of comprehensive health data, the session will highlight grassroots efforts, including community science and interdisciplinary photojournalism, health studies aimed at bridging this information gap and increasing awareness towards more structured public health studies to inform policy. Additionally, the session would touch upon challenges in state responses to remediation strategies in addressing the complex interplay between ecological preservation, environmental pollution, and health disparities. Excellent. Okay, so I'm going to briefly introduce our panelists, and I guess I have it, wow, almost in exact order. That's amazing. So that's just by chance. All right, so to my left, I have Dr. Ann Cheney. Dr. Cheney is an associate professor in the Department of Social Medicine, Population, and Public Health at the University of California, Riverside School of Medicine. She is a medical anthropologist and conducts community-based participatory research as a vehicle to empower grassroots leaders to activate communities and change narratives of health and well-being. Dr. Cheney's current work focuses on the impact of structural inequality in health with a focus on Latinx and Indigenous Mexican immigrants in rural desert communities in the inland Southern California. She's a founder of HABLAMOS, the Hispanic and Bilingual Ambulatory Medical Studies curriculum, and faculty director of Coachella Valley Free Clinic. Okay, moving on. Dr. Will Porter, to the left of Dr. Cheney, is an assistant professor in the Department of Environmental Sciences at University of California, Riverside. His research interests include regional and global scale air quality monitoring, low-cost air quality sensor networks, and the application of these tools to human health and environmental justice questions. Okay, moving on. Dr. Ryan Sinclair is an associate professor of environmental microbiology at Loma Linda University School of Public Health and an assistant professor in the Department of Earth and Biological Sciences. He completed his PhD on water quality from Tulane University and has a postdoc in environmental microbiology from the University of Arizona. He was recently awarded the 2021 SCAQMD Clean Air Award. His research covers several topics related to health-related environmental microbiology challenges in environmental justice communities. And lastly, we have Dr. Lily Wu. Dr. Wu is California's primary community air protection toxicologist with extensive risk assessment experience. Her responsibilities include assessing health benefits of community emissions reduction plans and consideration of cumulative exposures of multiple chemical and non-chemical stressors in addressing communities' disparate health outcomes. Dr. Wu serves as a technical expert on several federal, academic, and local advisory committees, ranging in topics from health equity, cumulative impacts, and pesticides. She helps bridge research partnerships between scientists and community to increase relevance for regulatory programs. So that is an introduction to all of our amazing panelists today. I would like to just start with the first question for our panelists. So this first question is, who are the current stakeholders involved in maintaining the Salton Sea, and how are they involved in assessing the health impacts of the Salton Sea? Would anyone like to start? We can, any order, whatever you're comfortable with.
2 PhDs to figure this out. Okay, so I would say we're all stakeholders in different ways. Given the lovely keynotes this morning about building different connections, about it really starting at the local level. So as I work with 2 of the 3 AB 617 communities, which is part of the community air protection program that the state has, the third one just having started relatively new this last year, which is why I haven't fully engaged yet, but we're all stakeholders. The community is who informs us scientists on a global scale, and also the regulatory agencies that need to be involved, whether they be local like Air District, state agencies like OEHA, the Air Board, Water Board, and the like, and then the federal agencies like the US EPA. And so we're all stakeholders in our different areas.
Oh, yeah, please.
Okay, you can hear me. So I think it's also really important to recognize that the Salton Sea occupies the historic Lake Kauai. And so it's the Desert Kauai who also caretake or are the original caretakers of that land. There's also now an indigenous group from Michoacan, Mexico, the Purepecha, and the largest stateside group of Purepecha live in the eastern Coachella Valley. They live on primarily the Torres Martinez Indian Native American lands. So I think it's also just really important to recognize the diversity within the community around the sea and how they are and have been caretakers and stakeholders.
Hey, I wanted to address that as well. Building on what both Ann and Lily just said, especially the Torres Martinez tribe. The local community there as well, the Latino community is definitely a stakeholder of the Salton Sea. And I think sometimes the challenge with the governmental agencies is actually to engage the local community. And so some of the maybe this is like further questions on the panel, but some of the duties of scientists is really to figure out what the local community, including Torres Martinez and the locals that Ann talked about, what they want to see for the Salton Sea and what that vision is, and to just facilitate that. So if you look at the stakeholders as a broad definition for the Salton Sea, we made a figure on our community science website. It's called saltonseascience.org. You can look at it. It's kind of, if you scroll down the first page, it's there, but it has this big Venn diagram of state, federal, and local or regional governmental agencies. And it's just probably about like 30 different groups or more or less. And, all of these have very defined jurisdictions on what they do. Like, for example, the SCAQMD, the South Coast Air Quality Management District. They're monitoring air quality, and specifically they're monitoring air emissions that happen in that area. Not mobile sources, but emissions that happen there. And to get that group to solve something as complicated as, what's coming out of the Salton Sea that's building in the water and then, blowing through the air and then landing on the community. That's a pretty complicated question. And, one single agency isn't going to be able to answer that. But I just wanted to present that as a kind of a challenge of the stakeholder idea. So the obvious priority on stakeholders should be the community that lives there.
Yeah, these are all, of course, very excellent observations here. I just wanted to, rather than just add more stakeholders, just observe that it's a very complex situation in terms of the number of voices and the number of interests, not all of which prioritize the same outcomes or want to see the same vision for the Salton Sea manifested, and not all of whom have the same amounts of power and privilege. And so that makes things very challenging when we're navigating, of course, priorities. And of course, these groups that we've already been talking about here include the ones who are most directly impacted by policy-driven outcomes at the Salton Sea. And so I think it's definitely very pertinent when we're talking about environmental justice, just to observe who is impacted and how they're impacted in these different kind of scenarios that we look at for the future of the Salton Sea.
Great. I think that actually naturally leads into one of the next questions that I have here. which is how are we currently assessing the health impacts of those living around the Salton Sea, particularly the most marginalized peoples around the Salton Sea?
Okay, so I can begin. So Will and we worked on a couple projects now, and in all of the projects that we're working on, they're community-based participatory research. And so it involves building the capacity of grassroots community leaders, as well as participants in our research study or studies to be able to be involved in creating an evidence base that then can be used to inform policy. And I think what's really important that's related to the previous topic that Will also mentioned is the communities that are along the sea, many are very, they're impoverished and they're vulnerable and they may not have a political voice. And so oftentimes I feel, or I think about research as an opportunity to anonymize the perspective of those who maybe don't feel as comfortable, don't have documentation status, for example, to feel as if they can advocate for themselves, their family, and their community. And so a lot of times I see research as an opportunity for people to voice their opinion. And for those individuals with whom we collaborate, like our team of promotoras or our community investigator, who can then elevate their voices and bring that evidence that we've generated through research to bring it to public spaces so that there then can be an awareness. When I first started doing research in the Eastern Coachella Valley, our community collaborator, her name is Maria Posard, she had said to me, one, that any work we needed to do had to benefit the community. There had to be a direct benefit to the community. And over time, she's learned that when she's in meetings, particularly with diverse stakeholders who have more power than her, so state representatives, for example, that they often say, well, where's the evidence? Where is the data? And now, because she and her team are generating the data, she can bring it forward and say, this is what we know. This is what we've learned.
Sure. So the question is, how have we been measuring and assessing the health impacts of those living around the Salton Sea, particularly the most marginalized peoples?
We should also bring up with this question is the data disparity issue is that in that community specifically, there's just a really, it's really hard to get health data about the population there. Just working there for probably almost 10 years now, trying to figure out, sleuth out the data from these different agency websites and things. It's very difficult to get data. So what Anne said about truly the getting people involved in research is important for them to be able to give anonymous information and have that be carried forward. But we also have a duty to really facilitate what research and what the community wants to know wants everybody else and all the agencies to know about them and prioritize. And so that is a challenge, and that kind of leads to the data disparity problem that you have in these EJ communities that are often around huge climate change and environmental challenges. Yeah. So as far as what we can do, I worked with this group called Alianza in Coachella Valley, and we finished this health survey in 2016. But that was great, and it was all participatory. We used promotoras to collect the data, and it was a person. It took us 2 years to collect all the data. But the findings and getting that information out, we even discovered within our own network of people organizing and funding the survey, there were so many differences of opinion, it really slowed down how you can actually disperse that data. And so then, trying to solve data disparity, we found ourselves in the situation where, wow, we're not even able to give the community back the data that we collected. And those kind of situations, I mean, it sounds kind of rare, but it's much more common than you think to get into that kind of challenge is that you really, to solve that, you really just have to put community first, and you have to help them facilitate, or you have to help them amplify what they are saying rather than getting stuck in your own kind of mix of differences of opinion of how data is presented and what stakeholders it's presented to, et cetera.
I wanted to build upon a lot of what was said being the regulatory scientist in this space, I get to understand all of the academic research, not only from our state, but from peer-reviewed published literature as well. And so that's where I think the keynote this morning was talking about science can cross boundaries, and science, once it's published, can cross all those boundaries by educated, scientists that work in the different spaces, whether public sector or academic or even local. And so to the bridging that I see that still needs more solid connections is that in our regulatory space, I'm talking federal, state, and local, there are still hurdles to overcome. And particularly in our environmental media, we have air, water, and soil. And so when I work with communities and they're talking about, I have this health effect from whatever source, air, water, or soil, we have all three media in our environment. And so for regulatory agencies who have to work in silos, because air is regulated by one agency at different levels of government, water is regulated by different levels of government at different agencies, and so on. And so you have all of these connections to bridge. And in that space as well, our ability to do risk assessment of different exposures is complex. And so we have different uptake of social science understanding as well as chemical understanding. So this non-chemical and chemical stressor is another bridge to build. So just highlighting the complexities of all of these things that we need to talk about with all of the different stakeholders and traditional knowledge, and bridging that as we have an ecological problem as well as a chemical pollution problem. The Salton Sea is something that everyone is needed to address.
Yeah, I'll just add in one kind of example from my own work that kind of speaks to the complexity of this question. And it's tough because I think that all of us are in different ways kind of responding to the question with it's complicated. But I'll add one more of those on there, which is that we looked at this question. A student, a then graduate student, Yaning Miao, who's now with CARB, a couple years ago worked on a paper investigating two different metrics of looking at this question about health outcomes. And she chose for the data sources to kind of analyze two of the kind of quote unquote objective metrics that we have, which one was hospitalizations. So looking at respiratory and cardiovascular hospitalizations, breaking it down by the zip code of where the patient came from. We know this is an imperfect metric. Not everybody goes to hospitals when they have symptoms. Not everybody has the ability to go to hospitals when they have symptoms. And so we know that that's a tip of the iceberg kind of metric, but we were just interested in what we were going to see from that. And for the other data source, we chose a community-based survey from HARC, which was done by telephone surveys. And this was to call people. Again, a very biased metric. You're not going to get a perfect representation. Not everybody's going to want to talk about their symptoms on the phone with a stranger. Not everybody is going to want, but we were hoping to find some insights in comparing these two imperfect metrics to learn more about their relative strengths and weaknesses. And what we found was that each one painted a very different and sometimes opposite picture. We knew from the survey data that we were not getting a representative sample. But of course, statistically, there were attempts to kind of normalize and to account for that. And then when we look at the hospitalizations, we sometimes see on the map, just in some cases, in some areas, it would actually be